The amendment is considered as read, and the gentleman from Arizona is recognized for 5 minutes.
I thank you, Mr. Chairman. In the midst of this debate, I think sometimes we have a tendency to miss what's good about American health care. Indeed, medical innovation, drug development, expeditious diagnosis, and timely treatment has made the United States the world leader in breast cancer treatment and indeed in all forms of cancer treatment. As this chart shows, the 5-year survival rates in the United States for all men's cancers are better than those in Canada, Europe, or England. It is also true for all women's cancers that our 5-year survival rates are better than in Canada, Europe, or England. The focus of this particular amendment is breast cancer, but before we go there, I want to mention prostate cancer. The survival rates, the 5-year survival rates in the United States, as this graph shows, taken from studies done by Concord and published in Lancelot Oncology, the 5-year survival rate in the United States is 91.9%. In Britain, by contrast, it's 50%, dramatically lower. The amendment I have put before you focuses on breast cancer. We have a saying in the Shadegg family: anytime or any day on which neither a member of the family nor anyone we love is diagnosed with cancer is a good day. I think cancer is the disease about which Americans are most concerned, and I'm pleased to have support on this amendment from my colleagues Mrs. Myrick of North Carolina and Mrs. Blackburn of Tennessee. This chart shows that breast cancer survival rates in the United States, again, are significantly better than in Canada or in Europe or in England. And I would hope we would want to preserve that. And so what the amendment simply says is that once a year, the Government Accountability Office would conduct an annual study concerning breast cancer survival rates and reveal that information, and that if in any one of those studies it turns out that breast cancer survival rates in the United States are declining by more than 1%, 1/10 of 1%, then women in the United States could choose to pick a plan that focused on breast cancer, a plan that devoted resources to preventing and or treating breast cancer, or otherwise focused its efforts on this terrible disease. I think it's a reasonable step. It's an effort to make clear that we are concerned about this disease, and with that I'd be happy to yield to my colleague, Ms. Myrick.
I thank the gentleman. I'm a 9-year breast cancer survivor, and I was a beneficiary of our good health care system in the fact that literally I was able to see six doctors all total, have 3 mammograms and an ultrasound before it was finally diagnosed, because I knew something was wrong. And in other systems, I would not have had that benefit. So it's extremely important that we do everything we can to protect this in this bill, that we're sure that there is no decrease in the advantages that cancer patients have now today, and that they will still have those under this plan the way it's subscribed today. Thank you, and I yield back.
I thank the gentlelady, and I would now yield to my colleague from Tennessee, Ms. Blackburn.
I thank the gentleman for the amendment and for what the amendment accomplishes for women. I think one of the greatest fears for women as they are looking at what would happen with a transition to government-run health care, they fear what would happen to their care, especially if they have a risk of breast cancer or if they are survivors. And there are 5 things that this bill would do that are important to breast cancer survivors. Number 1, in no way would the care be diminished that a breast cancer patient is entitled to receive. Number 2 is the GAO study that Mr. Shadegg mentioned, making certain that they look at the changes to the 5-year survival rate. It would require, number 3, the Secretary of HHS to annually certify that no decrease in those rates has occurred. And number 4, if they do find a decrease, the amendment allows women and their families with female members to purchase benefit mandate-free coverage of their choice, something that would meet their needs and also address their fears. And 5th, it would make certain that they are not forced to buy expensive essential benefit insurance that would include items they do not need. I thank him for his leadership, and I yield back.
I thank the young lady for yielding back. My oldest sister is a 20-year breast cancer survivor. I praise the fact and am thankful every day that she has survived that disease. I think this is a reasonable amendment. I hope we'll adopt it, and I urge the committee to do so in the strongest possible words.